The standard practice is to use dermoscopy to diagnose basal cell carcinoma. Although efficient and most of the clinicians with a lot of experience have no trouble in diagnosing it, it's still not so common in the newer generation of dermatologists. They like to use more advanced tools and understand better what they are dealing with. So that's one motivation, but the main motivation for our technology is actually not to only help diagnosis, but also to help therapy guidance. So confocal microscopy provides en-face images, so from the top towards the depth of the tissue with submicron resolution. So it helps very well to detect features of the basal cell carcinoma. However, its penetration depth is limited to only around 250 microns. So it's hard with using confocal alone to figure out what is the depth spreading of the tumor. Therefore, we came up with the approach of combining confocal microscopy with optical coherence tomography. So optical coherence tomography provides cross-sectional images similar to ultrasound, but with 1 order of resolution improvement. So it can be used in combination with confocal to tell the clinician how deep the spreading of the tumor is, and therefore they have the option to actually choose various treatment methods. And these days, non-surgical therapy methods seems to take some priorities among, especially on people that do therapy on the exposed area of the skin, like hand surface, neck, head area. So we developed this technology. It's the only device that's gonna provide this dual-modality imaging. We tested it at Sloan Kettering Cancer Center. We initially started just to see how well it improves diagnosis and how it helps clinicians to do a better job in diagnosing various stages of the disease. It also has proven useful to reduce the number of unnecessary biopsies, because sometimes dermatologists can be wrong. They see something that might be potential cancer. They do a biopsy and figure out that in fact it's not cancer. So RCMOST has helped them to improve diagnosis specificity. And in a more recent study, we showed that this technology can be used to guide treatment. And there are 2 treatment options that were selected. One was laser ablation therapy. So Dr. Chen at Sloan Kettering conducted a study on over 100 patients and used our device to actually figure out the spreading depth of the lesions and guide laser ablation therapy, and that was very successful. And Dr. Christopher Barker, as a radiation oncologist, has used our technology to guide the radiation therapy of basal cell carcinomas. He conducted this study on around 24 to 28 patients, again successful. There are now recurrence after more than 12 weeks, and they are still keeping the patients under observation to see if there's any recurrence further later on.